Leading the presentation this evening is Dr. Priyanka Sagar, and Dr. Priyanka is a nephrologist at the Nepean and Blue Mountains Hospital. She completed a PhD focusing on potential therapies for cardiovascular disease in polycystic kidney disease at the Westmead Institute for Medical Research under the supervision of Professor Gopi Rangan, who also joins us tonight, although I will note he's actually on call, so he's more here for moral support, and we're very grateful that he is there in the background. So in 2022, Dr. Priyanka and Professor Gopi led a 5-week clinical trial that tested treatment for high blood pressure in people with autosomal dominant polycystic kidney disease. And the aim of this clinical trial was to determine whether beetroot juice, which is a rich source of nitrate, lowers blood pressure in people with ADPKD. And I know that there are a few trial participants here tonight. So I wanted to say that from the outset, if you actually have any inquiries about the trial, please feel free to contact me at manager@pkdaustralia.org, and I will then connect you privately to Priyanka so we can have those questions answered. So tonight's webinar is about the effect of beetroot juice on blood pressure in ADPKD. So Dr. Priyanka, over to you.
Thank you so much, Jess. I'm just going to share my slides and then we can get started. There we go. I hope that's sharing now. Is that good, Jess? So I hope, thank you so much everyone for joining today on a Wednesday evening. We really appreciate your interest in this topic, and I hope that this will be helpful presentation. So I'll just get cracking. So today's talk is focusing on the clinical question that does nitrate in beetroot juice reduce blood pressure in polycystic kidney disease? As Jess gave me such a lovely introduction, so my name is Dr. Priyanka Sagar. I'm a nephrologist. I work at Nepean Hospitals and Blue Mountain Hospital. And the research study that I'll be presenting today was part of my PhD, which I did through the Centre for Transplant and Renal Research at Westmead Institute for Medical Research, which is part of the University of Sydney. And the trial was done out of the Department of Renal Medicine at Westmead Hospital and the Western Sydney Local Health District. As I mentioned, the whole presentation is looking at the effect of nitrate in beetroot juice at reducing blood pressure. So there's just a few acknowledgements I'd like to make. So I'd really like to thank PKD Australia, because this trial was done with a PKD Australia seeding grant and couldn't be done without it. So really appreciate their funding. My PhD stipend was provided from the Jerry Coates Scholarship through the Institute of Clinical Pathology and Medical Research at ICPMI in Westmead. And the research was approved by the Western Sydney Local Health District Human Ethics Research Committee. So they were our research ethics sponsor. And this trial was registered on the clinicaltrials.gov, which is an international website for trial registration, and was led in accordance with those guidelines. This trial has been published. The protocol for it has been published in a medical journal. And these were our co-authors and the study team that were involved in the trial, particularly mentioning Professor Gopi Rangan as well, who's online today. The work has also been presented at the European Renal Association meeting in Stockholm, and we were able to present the results there. And the current manuscript for the results of the trial has been submitted for publication and is just pending a review. So that will be published as well in a peer-reviewed journal. I'd also, like to thank the study team for the opportunity to present these results, and also to really thank all our participants, because of course we couldn't do this trial without the fantastic participants that were willing to be a part of it. So I know some of are online today, which is really great. So I'll just share the contents. So today we'll be talking, as I mentioned, about ADPKD and high blood pressure. I'll explain the rationale for our study, so why we chose beetroot juice. I'll explain a little bit about the BEETPKD, the study design of our trial, which will hopefully be helpful for people who are interested in the trial, but also I'll be talking a little bit about how clinical trials are done, and it might give some insight to people who are interested in how a trial such as this was conceived and then implemented. And of course, I'll be sharing the results of the trial, and then we'll have time at the end for some questions. So just to talk a little bit about high blood pressure or hypertension. It's quite common in polycystic kidney disease. Sorry about that. Quite common in polycystic kidney disease. It's in about 80% of patients with this condition. Often it's detected routinely before anyone has any symptoms of high blood pressure. And it's often the initial presentation of polycystic kidney disease, and often how people find out that they have the condition if they weren't aware of a family history. And most of the time, it requires some treatment with medications. So I just wanted to talk a little bit about the causes of high blood pressure in polycystic kidney disease. So we know that the condition is due to a genetic variant in the PKD1 or PKD2 genes, and that leads to autosomal dominant polycystic kidney disease. Predominantly, this condition results in cysts in the kidney, which can lead to kidney disease, and that leads to an increase in these hormones called renin or angiotensin converting enzyme, or ACE. These hormones, when they're elevated, they lead to high blood pressure throughout the body. But there's another avenue through which you can get high blood pressure in polycystic kidney disease, and that's through a direct effect on the actual cells of the blood vessel. And what happens is, due to the genetic variant, the cells in the blood vessel are unable to relax normally. And there's a big there's a shift in the mediators of the blood vessels, and that can happen. And in that case, because the blood vessels don't relax normally, they can constrict, and that can cause high blood pressure. So one of, two or together, these things can result in high blood pressure in polycystic kidney disease. So how is it normally treated? So our main recommendations for treatment is to reduce your dietary salt intake, and that's through minimizing processed foods, through reducing the amount of salt that you add in your daily diet. It's by maintaining a healthy weight range, and that's through regular exercise and a balanced diet with, a variety of vegetables and healthy meats. And blood pressure lowering medication when required. And the medications that are usually used first line are things such as ACE inhibitors or angiotensin converting angiotensin receptor blockers, or ARBs. And these are medications that usually end in a pril, like enalapril, for example, or a sartan, like candesartan. These are usually first line, unless there's some reason why you might be intolerant to them. And the reason why is because these medications block that arm of that hormone that's sometimes abnormal, as I mentioned, in kidney disease. So that's why these medications target that kidney disease arm of blood pressure. So the main reasons is it lowers your risk of cardiovascular disease. So that's one very important benefit. The other benefit is treating high blood pressure your risk of kidney disease as well. While I mentioned we have medication that looks at the hormone levels that can be elevated in kidney disease, we were interested in the other arm, that which was the direct effect on blood vessels from the genetic mutation. What we know is that there are some mediators within the blood vessel that help them relax. And a big one of those is nitric oxide. And nitric oxide is made by the blood vessels, and when it's released, it relaxes them. We know that you can have lower levels of nitric oxide in polycystic kidney disease, and that can mean that the vessels don't relax normally, and instead they constrict, and that can lead to high blood pressure. So we were very interested in how we can correct this potential reduction of nitric oxide. And so we looked at ways that we could increase your nitric oxide naturally. So what we do know is that nitric oxide can be made from the breakdown of a product called nitrate. And what happens is nitrate can get broken down to nitrite. Hoping is that when you absorb it through your gut, you can your blood vessels will relax, and that's what studies have found. So we looked into there have been studies that show that you can break down food in this way, and that it does result in increased nitric oxide levels. So where can you find nitrate? Nitrate is found naturally in vegetables. And studies have shown that you can increase your blood nitric oxide by consuming dietary nitrate through this process. So why beetroot juice specifically? So as I mentioned, dietary nitrate is found in all vegetables, but those with very high levels of dietary nitrate are beetroot, spinach, kale, lettuce, bok choy, radishes. So looked at previous studies of beetroot juice, and there are actually none in polycystic kidney disease, but there have been at least 22 clinical trials that tested beetroot juice in a trial setting, and those showed that it actually was effective at increasing nitric oxide. So the nitrate in the beetroot juice could be broken down and converted to nitric oxide. It also showed that it was beneficial at reducing blood pressure in people with and without high blood pressure, and in people who had other medical conditions, so chronic kidney disease, so not polycystic kidney disease in particular, but kidney disease as a broad term, those that had lung disease, people of older age, and people who were obese. So it was found to be effective at lowering blood pressure. A big area that beetroot juice was tested in was in the sports medicine field, particularly because, as I mentioned, the nitric oxide is important in relaxing blood vessels. And so what that does is it can actually improve your blood supply to your muscles. And some studies were focused on that and did show that it was effective at improving blood supply to muscles. And it also showed some studies were specifically done in athletes and trained individuals because they wanted to see if it had an improvement in exercise tolerance, reactivity, and speed. And it was found to be beneficial in that. So it is it's a compound that has been tested quite frequently in the sports medicine arena. And it might be something that you've heard of as well, particularly because it's had media coverage in that area. It's quite a few years ago now, but those of you online who are English Premier League or soccer fans might have heard about Leicester City's win many years ago now, but they were the sort of lowest ranking team and they ended up winning the league. And part of their pre-game ritual was to have beetroot juice. So it's not a randomized control trial by any means, but certainly an area where beetroot juice had a lot of media coverage. But why did we choose beetroot juice for our study? It's a natural dietary source of nitrate, as I mentioned, and we do know that people with PKD and doctors and stakeholders who are interested in it are interested in non-drug or non-pharmacological approaches to managing this condition. So we thought it would be really interesting to look at a dietary intervention or lifestyle intervention to help with blood pressure in polycystic kidney disease. As we mentioned, there were previous tests and trials done that showed that it was beneficial in lowering blood pressure. So there was some evidence that beetroot juice could lower blood pressure. And there were no studies in polycystic kidney disease, so we were interested to do that. So we asked the study question, does nitrate in beetroot juice lower blood pressure in polycystic kidney disease? And that's how the BEETPKD trial was developed. The point of this trial was to look at the effect of nitrate in the short term to see if it had any benefit in polycystic kidney disease. It was a pilot study, and so the long-term effects were not part of it, but we were very interested to see if it could lower blood pressure. So which beetroot juice and how to go about doing this? So we found that a lot of the previous studies used a commercially available product to keep to basically maintain quality control, so to ensure that all participants received the same amount of beetroot. So we also chose to use a commercially available product, which was a concentrated beetroot shot, and that was 100 mils. And this contained 400 milligrams of nitrate. And again, this dose was chosen because it was similar to the doses used in the previous trials and shown to lower blood pressure. So we chose the dose that had been tested before in other conditions. This was the nutritional information, which I think is very important to know about, and we did receive some questions on it as well. So just thought I would go over. It's a product that had 0 fat. It had a little bit of carbohydrate, but most of it was from vegetable because beetroot is quite a low GI product, so it's not a high sugar containing product, but it has carbohydrate. And relatively low salt as well. The other question was about oxalate. So this is something that we considered as well when choosing this product. And it has about 60 to 70 milligrams of oxalate, which is less than the daily dose. So the normal recommended dose is about 100 milligrams, but so this doesn't hit the recommended amount of oxalate. So for those who had questions about the oxalate. So the BEETPKD study design. So just to talk a little bit more about the study and how it went. So we had 60 participants between May 2022 and March 23. There were 2 groups of 30 participants each. One group had beetroot juice, which contained the 400 milligrams of nitrate. And the other group had the same beetroot juice, but with the nitrate removed. So it still contained all the other contents of the beetroots. This is a picture of the two bottles. One is a nitrate containing beetroot juice, and one is the nitrate removed. And as you can see, we use the company, we got them to use the same labeling for both, even if they didn't have nitrate in them. So and they looked the same and they tasted the same, and so it was so participants were unable to tell which group they were in. The study is also what we call a double-blinded study. So that means not just the participants didn't know what they were having, but even the study coordinators, the study staff didn't know which drink they were having. So anyone that was involved with participant-facing elements of the trial were unaware of which participant got which juice. The main things that we looked at were change in blood pressure from baseline, so from the start of the trial, to 4 weeks after the trial, to 4 weeks after the start of the trial. So for 4 weeks of daily beetroot juice. So participants had one of those bottles, one of those shots every day for 4 weeks. The secondary endpoints and other things that we looked at were changes in home blood pressure. So participants measured their blood pressure every day across the 4 weeks. And we wanted to see if there was a change, whether there was a change in urine protein levels and any changes in the blood nitrate. So this here is just a schema of the trial, just to show people again what we did and how it was done. So our study population, as I mentioned, were adults with polycystic kidney disease. They had to have relatively good kidney function, with a kidney function of an eGFR of 30 mils, over 30 mils per minute. And they had to have treated blood pressure, so to be on some medication for blood pressure control. The first visit was a screening visit, and at that point we took a history, we measured participants' blood pressure, and we did a blood and urine test. We also showed participants how to measure their blood pressure. A lot of them already knew, but for those who just needed a bit of a brush up, we taught them how to use the blood pressure machine and asked them to measure their blood pressure every day for 7 days. And this was to get a baseline blood pressure in that screening period to compare to for the rest of the study. Then at week 1 of the study, participants were asked to start their beetroot juice and were randomized. So they were randomized in a 1-to-1 ratio, meaning that 50% of people got the nitrate replete beetroot juice containing the 400 milligrams of nitrate, or the nitrate deplete beetroot juice, which had 0 nitrate. And then they started the intervention period of the trial, where they measured their blood pressure every day for 4 weeks. And the measurements were actually done in triplicate. So every day they measured their blood pressure 3 times, and we took an average of the blood pressures. And then they would drink their beetroot juice and then report the blood pressures to the study team. So this was done via text message. So we sent a daily text message reminder, and participants would reply with their blood pressure results. This allowed us to be in contact with participants quite frequently as well, and they could bring up any issues that they were having, and we could check that they were able to continue the intervention. And then at the end, at week 5, the trial, they came back for a final visit, and we took a history. We asked participants about any side effects or changes they might have noticed. We measured their blood pressure and then took a urine and blood sample. So we want to share this diagram, which is called a consort diagram. And it's something that we share, and it's something that a lot of clinical trials share, which is what actually happened to participants from the start of the trial to the end, in terms of where we collected the data and how the trial was recruited for. So we actually started off with 376 participants that were assessed for their eligibility, and from that 63 were consented. That's because some participants didn't meet the inclusion criteria, so they were maybe not on blood pressure tablets, or didn't fit in with the diagnosis or the cutoffs, or they didn't respond or declined to participate. So from the 63, 60 underwent randomization, and 3 participants had a screen failure where they once again didn't fit the inclusion criteria. So from the 60, as I mentioned, 30 were allocated to the nitrate deplete juice, and 30 were allocated to the nitrate replete juice. And from that, 30 patients completed the study in the deplete arm, and 29 completed the study in the replete arm. 1 patient was lost to follow-up due to personal reasons, but we were still able to use what data we had for the analysis, and were able to. So we were able to use most of the data that we collected. This will also be part of the results manuscript that, as I mentioned, that's been submitted. So what did the results show? So as expected, the nitrate replete beetroot juice, which is this column here, increased over the 4 weeks of the trial. So I'll just talk you through this graph here. So we've got the nitrate replete group with the 400 milligrams of nitrate on the left-hand side, and the nitrate deplete group here on the right-hand side. The clear boxes are the measurement at the start of the trial, and the gray boxes are the measurement at the end of the trial. And you can see they started off with a total nitrate of just under 10 and ended up with a nitrate just above 30. So there was about a 3.4-fold increase in, sorry about that. 3.4 increase in the nitrate levels in the nitrate containing group. And in the nitrate deplete group, you can see that there wasn't much of a change before and after the trial. What we also had was based on the text messages and replies to text messages, and based on how much beetroot juice people had at the end of the 4-week period, we actually had an average of 100% adherence to the trial protocol. So participants actually were able to take the juice 100% of the average of 100% of the time, and were able to do their blood pressures, which is really great. And we're very thankful that our participants didn't find the intervention too cumbersome and were able to sustain it for the 1 month of the trial. So what was the effect on blood pressure? Which is the big question. So once again, I'll just take you through these graphs. So these are broken up into systolic blood pressure, which is the top number. So if, say, you've got a blood pressure of 120 on 80, it's the 120 part. And this is the diastolic blood pressure, so the 80, the lower number. What we found was that in the nitrate replete group, the systolic blood pressure from the start of the trial to the end of the trial went down by about 5 milligrams of mercury, which is on average, quite significant. And then in the nitrate deplete group, again, the blood pressure from the start of the trial to the end of the trial also reduced by about 7 milligrams of mercury. And similar again with the diastolic blood pressure. So there was a drop in the blood pressure in the nitrate replete group, and a drop, but not as significant, in the nitrate deplete group and diastolic. So the blood pressure decreased in both groups after 4 weeks of daily beetroot juice. The main point that was interesting was that there was no difference between the groups. So the nitrate containing group and the nitrate deplete group didn't have a difference in their blood pressure. This home blood pressure readings were very similar. They showed a very similar trend with a decrease over the 4 weeks, but no difference between the groups. And as expected, again, there was no difference between the groups in urinary protein levels. In terms of the side effects from beetroot juice, there was no difference in those that got nitrate-containing beetroot juice and those that got the nitrate deplete beetroot juice. There was the most common side effect that was reported was beetroot-colored urine and bowel motions, which we know happens with beetroot juice and expected and was harmless. But there were some gastrointestinal side effects as well, which was the next most common, which was reported in about 1/3 of participants. And this included changes in bowel habit, bloating, and gastritis. The changes in bowel habit were both positive and negative. So they included changes such as increased frequency of stools, looser motions, but also less constipation and more regular bowel motions. Those that had gastritis did have a history or had a history of requiring treatment and had limited episodes during the trial. 1/4 of the participants reported positive side effects. So they felt that, as I mentioned, some had improved bowel habits, so they felt less constipated. Some reported an increased energy, and 2 participants reported an improvement in intentional weight loss. So they found that they were more full after having the beetroot juice and were able to lose weight. So in summary, the trial question of does nitrate lower blood pressure in ADPKD, what we found was that that blood pressure was lower in both groups after 4 weeks of beetroot juice, but the nitrate in the beetroot juice did not lower blood pressure. So I guess this was quite interesting, and we thought, what might have caused this in this study? So why was the blood pressure lower? We think it's likely that there's another component or components in vegetables that lower blood pressure. So not nitrate specifically, but there are lots of other components that have been shown to cause relaxation of blood vessels. So that might be contributing. And these are things like betalains and polyphenols and flavonoids and vitamin C, all in combination together in vegetables could be what resulted in lower blood pressure in both groups. And also just the effect of participating in a trial. As I mentioned, we were in quite frequent contact with the participants. Participants were measuring their blood pressure every day, which might not be something that most people would do every single day. And whether that had an effect in the trial and in lowering blood pressure, it's a possibility. So the take-home message from this trial, which is really that healthy diet, including vegetables and possibly regular monitoring of blood pressure, both together are important for blood pressure control. And the decline that we saw was quite significant, and I think it's very interesting and just shows that lifestyle modifications are important, and eating a variety of foods and a variety of vegetables are important rather than one specific ingredient. And as I mentioned, this was a 4-week trial, so it was short term, so we don't know any long-term outcomes from it. But I think this is probably the main take-home message that I would take from this trial. And so that's sort of, and come to the end of the formal sort of part of my talk. I would really like to acknowledge PKD Australia again for their support and funding, and as well as my trial team, and of course Professor Rangan as well for leading the trial. And I'd also really like to thank the participants one more time for being part of the trial and being interested in this sort of intervention. So I'm happy to take any questions now, and hopefully have answered some of the questions that have already come through.
Thanks, Priyanka. One question has come through from Alyssa asking whether drinking beetroot juice is as good as eating it in terms of absorbing the nitrate.
Yeah, well, I think I guess so. What this trial showed is it's not really the nitrate that made a difference in the blood pressure reduction that we saw. So I think really it's something in the vegetable content. So this trial really doesn't answer that, wouldn't really answer that question, because we didn't really compare juice and plain beetroot. But what I would take from this is, that eating a variety of vegetables can have an impact on your health, and I'd really advocate for having that healthy lifestyle diet with comprising of vegetables to try and get that blood pressure lowering effect.
Thank you. And another question here, asking if you could outline exactly how blood pressure affects cyst growth in PKD.
Okay. Yes. So I guess that's kind of a quite a broad topic, which they've done a lot of work in the past. It's not the focus of this trial or this talk, but I guess I don't really know if I can speak to. We didn't look at cyst growth in this trial. We didn't look at changes in renal function in this trial because it was such a short-term trial. So we really just looked at changes in blood pressure. and if the blood pressure changed day to day, and if the blood pressure changed both at the visit at the start and the visit at the end. This trial wasn't powered or asked the question of, can changes in blood pressure affect cyst growth, which I think would require sort of a much larger trial of possibly a much longer time period in order to answer that question. I suppose more broadly with kidney disease, we do know that the better control, having uncontrolled blood pressure does worsen your kidney disease. But the question about cyst growth, again, we're not really, this trial wasn't really geared to answer that.
No problem. That's okay. Thank you. One more question. It says, in my industry, people drink beetroot juice to obtain the results required to pass their medical assessments. Could you comment on that?
No. No.
Slightly different area.
I have to say I'm not really, I'm a nephrologist, so I'm not really, I don't do medical assessments or know how that might impact things. I'm not sure. Like I said, it does have a, there are people that use it, especially in the sports medicine field, for those effects that some of those trials have shown. So we really based our choice of beetroot juice on the clinical trials that had been published. So we looked at peer-reviewed published papers that looked at the effects of beetroot juice on sports performance, on lowering blood pressure, and yeah. So I'm not sure. That's quite interesting. Yeah.
It is. I guess it all comes back to eat your vegetables.
Yeah.
To oversimplify what you've just said.
Well, I don't think it's oversimplifying at all. Yeah, I think that's what the trial showed, and it was short. It was over 4 weeks, and we saw an effect. So yeah.
Another question's come through asking, did the age of participants affect the result at all? What do you think about that?
The age of participants. So no, so we looked at what we call a baseline characteristics, and I haven't shared that in this study, but it will be in the results paper. So no, basically the age of participants, the gender split, all of the baseline blood pressure that started off with was all equal between the groups. So the same age bracket was split between the two groups. So it was randomly allocated, but there were no significant differences in the baseline characteristics. So things like age, gender, starting blood pressure was the same between groups. So it shouldn't have had an impact on the results.
Okay. Another question about you're referring to eGFR of 30 or over as being indicative of good kidney function. Could you please elaborate on that? Perhaps why you picked
I wouldn't
that
say,
indicator.
why we picked it. Well, we know that there can be other things that drive blood pressure as kidney function gets worse. So we picked a cutoff of kidney function where we thought it wouldn't interfere with us trying to answer the question about nitrate being converted, because we know that there are a lot of changes that go on in the body, and as the kidney function gets lower, those changes, including how your body metabolizes certain things, can change. So the cutoff of 30 is quite a standard cutoff that's used in a lot of trials, because we don't know much about what happens as the kidney function continues to get worse. So we picked, because this was a pilot study and we were looking at this for the first time in PKD, we wanted to limit as many biases as we could. So we were, again, not really looking at the effect of beetroot juice on kidney function. We were wanting to look at beetroot juice on blood pressure. So we were just trying to limit any possible confounders to the results. So that's sort of why we had a cutoff for kidney function. So I hope that makes sense. Yeah.
Yeah, great. So another question. Does the trial mean any vegetable might do the same thing as beetroot if it's not nitrate that's changing blood pressure?
I
You say
guess,
it's a
yeah,
pilot study. Perhaps you'd
yeah.
consider studying some.
Oh, sorry, Jess. I think I don't know if it might be my internet. Sorry, the end of the question cut off. You mentioned, yeah, it's a pilot study. Um, so where there are other vegetables. I guess what it is in this is I can say again from the trial that it wasn't the nitrate. But we haven't, and we haven't, I guess, tested all the vegetables. So certainly that is something that we could look at further down the track and it's certainly an interesting space to go into because I think, as I mentioned, participants and doctors who treat people with PKD and lots of stakeholders involved are interested in lifestyle modifications and lifestyle things you can do in this condition that don't have many side effects and are easily accessible. I think what this study supports is that it supports that it's not the nitrate in vegetables that's lowering blood pressure, but that there is some other beneficial effect. I think what I would recommend is to have a variety of vegetables rather than one specific vegetables that contain nitrate as the specific reason for choosing those vegetables, if that's clear enough. And certainly it's an area that needs more research, and I think there's been a lot of interest in what we can do for chronic health conditions in terms of lifestyle modifications and dietary modifications. Yeah.
Definitely. Okay. And one more has just come through. This person joined late. Is there any? It will be on YouTube, so you can watch the whole presentation. And I guess in short, we could say yes, although it's not necessarily the nitrate, it is the vegetable.
Yes, yeah, I would say it's beetroot was chosen for its nitrate content, and the study showed that the nitrate didn't make a big difference. So I would, I think it's increasing vegetables and having a healthy diet with a variety of vegetables would be the main take-home message.
Brilliant.
Yeah, and
okay.
possibly,
sorry, I think
and just being aware of your blood pressure as well and monitoring it. Yeah.
And just, I think we have time for maybe one or two more. Some specifics. The trial took place between May 2022 and March 2023. When were the 4 weeks of the trial participants monitoring their blood pressure? Is that earlier in the stage and you had more time to analyze the science and the data?
No, so it was sort of 4 weeks individually. So participants were recruited over that time period. So the last participant finished in March 2023. And the first participant started in May 2022. So it was sort of the 4 weeks started when they started with that first visit. So
Gotcha.
it wasn't that we had everyone in the one 4 or 5 week block. It was sort of the data was collected across that time period. And I think that was good. It allowed people to be flexible and, people who were interested but couldn't do the trial straight away were able to do the trial a few weeks later. So we did really try to pick a pragmatic trial design that would be easy for people to participate in.
Yes, no, that's wonderful. I'm always interested to hear how different clinical trials work. So thank you. One more on if nitrates can relax the blood vessels, could you or would you suggest a nitrate supplement that might work?
Yeah, I think as I mentioned, I think this study, it showed that it wasn't the nitrate that made the difference in the blood pressure. So I think this study supports, you know, not using, well, this study didn't show that the nitrate made a difference. So I wouldn't be recommending, based on this study, a nitrate supplement, because that's not what this study showed. Yeah.
Okay. All right. Well, I think we'll finish off there. Those were some really great questions. Thank you, everybody. And thank you so much, Priyanka, for taking all that you have learned and the massive efforts of the team and presenting that to us today. And thank you for taking time out of your maternity leave as well to join
Thank
us
you.
tonight.
Thank you. Yes,
And
I'm glad baby
um,
didn't start crying while we were online.
yeah. And yeah, on behalf of the PKD Australia team as well, it's really great to hear what some of our funding goes towards. And on behalf of the board, I would like to sincerely thank you. And for everybody joining tonight, again, if there's any participants who were part of the trial, if they'd like to send an email through to me, I'll make sure you get connected to Priyanka. And with that, we'll finish. So have a good evening, everybody.
Thank you. Thank you. Yes. Thank you so much. Yes. Thank you for the opportunity to talk and share the results. And yeah, thank you so much.
You're welcome. Good night.